Hello, this is Faye, and I am here to tell you about Medicare Made Clear. Medicare Made Clear is where we will talk about all of the aspects of Medicare. This is May 21st, 2020, and it might be that time when you are about ready for Medicare, or you may already have Medicare. I am trying to get my slide here together, so now we're ready to begin. Medicare Made Clear is this session tonight. Welcome and thank you for attending. It might be your birthday sometime in 2020 and you are going to be 65, which means that you're going to be eligible for Medicare. It also means that you need to start to think about it before that time comes. If you're currently 65 and still working, but you have not gotten all Medicare benefits because you're still working, it might be something that you may want to consider in the near future. So this is a meeting for you as well. It's a meeting where you can learn the parts of Medicare and the things you need to know about Medicare. So there are a couple of housekeeping things that I'm going to ask you to do. First of all, if you're not using your cell phone to attend this meeting, then I'm going to ask if someone calls you or your cell phone goes off, please don't answer, because the distraction for just a few minutes will cause you to miss something that you may have wanted to hear. The same thing goes for that landline phone, that old-fashioned phone that just rings off the wall. Let it ring for these few moments. There's one thing that I'm going to ask you to do. Get a pen and paper. And while you're going to get that pen and paper, let me just share some information that I have with you. My name is Faye Horton. I'm a licensed insurance agent, and I'm here in Florida. On each of the screens, you're going to see my cell phone number. At the end of the presentation, you will see both my office number, which is a Winter Haven number, and my cell phone number. Primarily, I work in Polk County. I live in Winter Haven, so that's where I am locally. However, I'm licensed in 6 states, so if you're listening to this meeting or you joined this meeting, it does not mean if you're not in Polk County that I will not be able to answer questions for you. What I wanted to share with you is that 23% of the 20 million or so people living in Florida are age 60 or over. And that means that there are about 400 to 450, 460,000 people here in Florida who may be eligible for Medicare. And you will soon be a part of that. Tonight, I'm going to take just 30 minutes of your time. And during those 30 minutes, you're going to have a 12-minute video by Carol Karstensen. Now, Carol pronounces her name much better than I do, and I don't want to have to say that last name again because it's difficult for me. But Carol will be giving you the 12-minute video. It's very concise, it's very appropriate, it's very clear, and she's going to tell you about Medicare A, Medicare B, Medicare C, and Medicare D. But Carol will also tell you what your choices are. So that will be laid out for you. And she'll tell you those things that you need to consider to make a decision. Now, don't get frightened and don't get up and leave because you're not asked to make a decision today. You don't need to make a decision today. What you need to do tonight is get the information that will help you to make a decision. And don't forget, my name, my number, my face is on every one of these slides. So with that pad and pencil that you have now, go ahead, write my name. It's Faye, F-A-Y-E. And my telephone number is 407-340-6282. Now, we're going to get right into Carol's 12-minute video.
Hi, my name is Carol Carstensen. I'm part of the Medicare Make Clear team. And I know from trying to learn about it myself just how much there is to know about Medicare. It can be kind of overwhelming at times, even if you've been at it for years. So today, I'm going to go over the basics of Medicare, because a strong foundation in the basics is going to help you understand your choices and make better Medicare decisions for yourself. We'll start at the beginning and talk a little bit about what Medicare is and who can get it. Then we'll talk about the parts of Medicare, what they cover, what they cost, and then we'll go into how to put those parts together to come up with coverage that works for you. So let's get started. Medicare is a federal health insurance program for people 65 and older and others who have qualifying disabilities. You also need to be a United States citizen or a legal resident. If you're a legal resident, you need to have lived in this country for at least 5 years in a row, including the 5 years just before you enroll in Medicare. Another important thing about Medicare is its individual insurance, meaning every individual person needs to qualify for it themselves, enroll in it, and choose coverage for themselves. This can be different from what you're used to if you've had a family health plan through an employer, for example. Government-sponsored Medicare is made up of two parts, Part A and Part B. Each part covers certain healthcare services. The two together are often called original Medicare, or sometimes traditional Medicare. There's also a Part C and a Part D, and Medicare supplement insurance, and we'll get to those in a little bit. So let's start with Part A. Part A is hospital insurance. It covers inpatient care when you're in the hospital or a skilled nursing facility. It covers your room, your meals, your nursing services when you're in the hospital, any equipment or supplies they're using in your care, operating room, whatever the needs are that you have while you're in the hospital or in a skilled nursing facility. Medicare Part B is medical insurance. It covers your doctor visits or your doctor services even when you're in the hospital. Other things covered by Part B include care when you're in an outpatient facility, like a clinic or the emergency room, for example. Ambulance services, if you need to go to the emergency room. Preventive care services like flu shots, medical devices that you might use at home, such as a wheelchair. Original Medicare, again, has Part A and Part B, and it does come with some costs. Those costs can include premiums, deductibles, copays, and coinsurance. Now let's start with Part A. Part A, in fact, is premium-free for most people. If you've worked and paid taxes, or your spouse has, for at least 10 years, then you get Part A premium-free. Otherwise, you would have to pay a premium. Other costs for Part A include a deductible and some copays and coinsurance. But importantly, you only pay for Part A when you're actually receiving Part A services, such as when you go in the hospital. So Medicare Part B does come with a premium, and that will be deducted out of your Social Security check if you receive Social Security. Otherwise, you'll need to pay it directly to Medicare. Other costs with Part B include some copays, a deductible, and some coinsurance. For most services, you pay 20% coinsurance, and that means you pay 20% of the Medicare-approved amount for that service, and Medicare pays 80%. So we've talked about original Medicare, Part A and Part B, what they cover and what they cost. But they don't cover everything. Neither Part A nor Part B covers prescription drugs, for example, dental or vision or hearing care. And this is where Part C, Part D, and Medicare supplement insurance come in. They offer you more coverage options. Let's start with Part C. Part C is Medicare Advantage. Medicare Advantage plans are offered by private insurance companies. They cover everything that original Medicare covers, all of your Part A benefits and Part B benefits. In addition, most plans will include prescription drug coverage and additional benefits like dental and vision coverage. The cost for a Medicare Advantage plan might include a premium or it might not. There are some plans that have $0 premiums. Other costs would include co-pays for services you receive and sometimes the co-insurance. Another important thing to know about Medicare Advantage plans is that they are required by Medicare to set an annual out-of-pocket limit. This out-of-pocket limit is like built-in financial protection because if you reach that limit, the plan would pay all of your costs for the rest of that year. There may be many Medicare Advantage plans offered in a region or a state or a county, and each one will have its own coverage and cost terms. Now let's talk about Medicare Part B. Medicare Part B is prescription drug coverage. You can get prescription drug coverage in two ways, either through a Medicare Advantage plan, like we just talked about, or through a standalone Part B plan. You can always remember prescription drug plans and Part B by thinking B is for drugs. Medicare requires that Part B plans cover all the types or classes of drugs that are normally used by Medicare beneficiaries. Every plan has a formulary or a list of covered drugs. So when you're choosing a Medicare Part B plan, it's really important to look at those formularies and make sure that the drugs that you take are on those lists. Costs for a Medicare Part B plan vary from plan to plan, but it usually includes a premium, and you'll probably pay a copay when you fill a prescription. What you pay in copays, again, depends on the plan and also on the formulary. Every plan places certain drugs on what they call tiers or levels of a formulary, and the level determines what you pay at the pharmacy counter. Usually the higher the level or tier, the more you'll pay. Costs for Medicare Part B will vary from plan to plan, but most plans have a pharmacy network. And if you fill your prescriptions within that network, you're going to get the best price for that prescription. Medicare supplement insurance is also called Medigap, and it's just what it sounds like. It supplements Medicare. Medicare supplement plans help pay some of the out-of-pocket costs that come with original Medicare Part A and Part B. These can include premiums, deductibles, co-pays, and co-insurance. Medicare supplement plans are standardized. They're labeled from A through N. There's 10 different plans with varying levels of coverage. For example, one plan might cover co-pays and deductibles, and another plan might cover co-pays, deductibles, and your premiums. So each Medicare supplement plan that has the same letter offers exactly the same coverage. However, plans may differ in what they charge. So a Plan G, for example, in one state may be a different price from Plan G in another state. The main purpose of a Medicare supplement plan is to cover the costs that come with original Medicare Part A and Part B. However, some Medicare supplement plan providers do offer additional programs that can provide discounted services for dental or hearing or other healthcare services. Medicare parts and plans can work together in different combinations to offer you the coverage you need. It really comes down to two scenarios. You can keep Original Medicare, Part A and Part B, and decide to add prescription drug coverage and or a Medicare supplement plan, or you can choose a Medicare Advantage plan instead, which encompasses all of the coverage in one plan. Medicare supplement plans work only with Original Medicare Part A and Part B. If you have a Medicare Advantage plan, you don't need and you can't use a Medicare supplement plan. People often ask, how do I know what's right for me? What Medicare plan should I choose? Well, that choice is personal because your health needs are personal, and each person needs to make a decision for themselves. There are a few things to think about as you look at Medicare plans and coverage in general. One, would you like to have additional benefits like dental or vision? If so, then a Medicare Advantage plan might be a better choice because they offer these options, whereas Original Medicare doesn't. Two, would you prefer to have lower monthly premiums and pay as you go, so to speak, when you go to the doctor with copays? Or would you prefer to have higher premiums and fewer copays or out-of-pocket expenses? In the first scenario, the Medicare Advantage plan might be your best choice because premiums are low and you pay only when you receive services. In the second case, Original Medicare with a Medicare supplement plan might be a better choice because your premiums may be higher, but you'll pay less out of pocket as you go along. Number three, do you have specific doctors or providers you like to see? Or do you travel frequently? If you do, Original Medicare might be a good choice for you because every provider in the United States is covered. Medicare Advantage plans often have a provider network, and you need to choose providers from within the network to get the plan's best prices. So there you have it. That's the basics of Medicare. And if there's just one thing that you take away from today, I hope it's this. You get to choose. You get to choose Medicare coverage that fits your health needs, your budget, and your lifestyle. If you need more information about Medicare basics or other Medicare topics, please visit us at MedicareMadeClear.com and follow us on Facebook for answers to your Medicare questions and regular updates on Medicare topics. Thanks so much for listening.
Thank you, thank you, thank you. Thank you so much. We're back, and I am just going to stop the videos now because we don't want to see them anymore. And I will get right back to you. Thank you again for coming, and thank you for listening to Carol's 12-minute video. Are there any questions at all? I did receive a question while the video was going on, and it was, when should I start to look into getting Medicare? Well, you can start enrolling in a Medicare supplement plan as far out as 6 months prior to your birth month. With the Social Security office, the Medicare office being closed in many, many areas, and where they are open, the staff they're not fully staffed. My suggestion to you would be that if you have a birthday in this month and in this year rather, and you're considering getting Medicare at all and being certain that you have in place what you need, then do it as early as possible. You can enroll in a Medicare Advantage or a prescription drug plan 3 months prior to your birth month, in which you turn 65 or become eligible, and the birth month, and 3 months after. But because of working conditions due to the pandemic, my suggestion would be that you do take care of your business as quickly as you can. Are there any other questions? I have a question that has come in, and it is, Why would I pay premium if I don't have to? It all comes down to your particular preferences, as Carol said. And as an agent, it's my responsibility to ask you what those preferences are and then show you the difference in the benefits and the plans. So I know by now that you've written my name, Faye, F-A-Y-E, and my telephone number. My cell phone is 407-340-6282, and I'm here to answer any questions that you might think of after this session. And my office number is 863-291-3435. Are there any other questions? I want to be here for as long as I can to answer any questions that you might have. If there's anything that you'd like to discuss about Medicare and Medicare Made Clear, or if you still need some more explanation, by all means, reach out and give me a call. You can also text me on the cell phone number. That's Faye Horton, 407-340-6282. It has been a pleasure to bring you Medicare Made Clear this evening. Thank you so very much